Good day. In this lesson, we're going to talk about the biopsychosocial implications of anxiety. Our objectives are to understand the difference between adaptive and non-adaptive effect of anxiety and on performance, and the relationship between stressors and that anxiety, the vulnerabilities for developing anxiety and related disorders that can come from excessive, depending on the individual, anxiety, and the diagnostic criteria for anxiety-related disorders. So, in a quick review, let's talk about our Piaget development stages. Within our operative and preoperative stages of development, including adolescence, we develop a certain fixed mindset, which is a protection that allows us intergenerational, ethnic, and sociological assimilation. In that, though, we develop a susceptibility to anxiety and a tolerance of certain levels of anxiety depending upon sociological influences. Those sociological influences are defined by Bronfenbrenner's ecological systems theory, in which our relationships and its underlying experiences, understandings bring meaning to our lives through conforming circles of support to help with stressors. Angela Duckworth, Ph.D., talks about D.C. and Ryan's self-determination theory. Angela Duckworth describes D.C. and Ryan's self-determination theory to engage thinking primarily in adolescence for a growth mindset. In adolescence, we develop the personality traits that allow us agency, autonomy, in order to go beyond assimilation from prior childhood experiences designed for protection. Childhood is for protection. Growth mindset is for actualization, to extensionalize our purpose per Maslow's needs. Stress, then, is an individual construct. The amount of stress a person can endure is individual to their development. And once a person gets to their optimal level of stress, distress ensues, meaning performance decreases once a person hits distress. This point varies based on the individual. What is optimal? Well, we don't know. It is individual, but our stressors have been increasing in the modern era, and our social support decreasing. Our goal isn't to blame our parents, because many parents are working 2 jobs in order to keep up with the economy and have less time to spend with their young children. How does a stressor affect us? Different ways. A stressor comes in as an initial impact. A person judges its threat. Is it a challenge, which allows us for future growth? Is it an opportunity, which allows us to capitalize on that opportunity to better ourselves or actualize our purpose? Or is a threat, which we respond to with fight, flight, or freeze? A threat may lead to harm. There's also a secondary appraisal system in which, after our initial amygdala response, we determine, is the threat high or low? In a high threat situation, we might react with fight, flight, or freeze. In a low threat situation, we might reassess and look for the opportunities for future growth. The theorist is William Cannon, who developed the idea of fight, flight, or freeze based upon a person feeling marginalized, invalidated, threatened, or isolated as a result that the world comes in as dangerous. Again, what's dangerous varies by person. Induces anxiety. Person becomes hypervigilant. And they can feel more marginalized as a result of feeling hypervigilant. Or the person might then say the world is a dangerous or traumatizing place in which the marginalization produced no results. And the hypervigilance allows either an increase, coping, or behaviors to react to the fight, flight, or freeze. Existentially, a person seeks the end to the threat or the stress. And in doing so, the appraisal system leads us to a reaction in alignment with our tolerance for stress and our ability.
I just wanted to get your opinion on something that has affected a few friends of mine recently.
Sure.
So some of my close friends have struggled with anxiety and panic attacks. These are guys in their late 20s, early 30s.
Right.
I just wanted your opinion on whether you think this is always rooted in childhood, and is there any practical advice you'd give to someone who's trying to get to the root of it?
Sure. So in general, I believe that most mental health disorders, in fact, I would say almost every mental health disorder, originates in childhood experience, and it originates as a coping mechanism. Now, if you look at anxiety, if I were to pull a gun on you, you would not be anxious. You'd be afraid, as you should be. So when are we afraid? When we're threatened with something. Either something bad happened to us, or something that we perceive as something that we need is threatened to be taken away from us. Now, in the early child's life, in a young child's early life, anxiety is an attachment alarm. What is the child's biggest need? Attachment with the parent, connection with the parent. When the parent's not around, the child should feel some fear. That serves a positive purpose, because when a child feels fear, he cries, she vocalizes, and that brings the parent. I mean, look at a mother cat responding to the kitten's cries, immediate. And the same with instinct, with human beings who are still connected to the parenting instinct, they will respond to the child's cry for help. So that fear is adaptive. So it's a coping mechanism. But now what happens to a person whose parents are taught by medical experts, like I used to, until I learned otherwise, or others, not to pick up the kids when they're crying? Now that natural fear that causes the crying, that brings the parent, which ends the anxiety, is embedded in the child. So what begins as a coping mechanism now becomes generalized. So under certain circumstances, there should be fear and anxiety. But when I have this anxiety, when there's no immediate threat, what is that about? It's not a response to anything external, it's the embedded anxiety that I developed as a child. Now, in a society that makes people more isolated all the time, where human social contact is replaced by the rather cold and impersonal world of the internet, and when people under genuine threat, where young people have less opportunity for meaningful employment and belonging and a sense of purpose than their parents used to, there's more general threat. Now when that general threat hits people who are in childhood over immersed in anxiety that's not relieved by the parent coming to help them, now you've got an anxiety situation. So when it comes to your friends with anxiety, I would get them to really look at their childhoods and to recognize that anxiety is really the cry of some desperate childhood part of themselves for help, and to learn to get help with that part. Not just to take tranquilizers or to drink booze, not to feel the anxiety, or not to go on the internet to soothe themselves or to escape momentarily, but to actually see that that anxiety is a normal response on their part to what actually happened to them, and that it can be relieved and recovered from if they look at its sources.
So back to Freud. Freud said our identity or purpose is who we are, whereas our ego is who we are masking to be in order to adjust to the superego, the stressors within society that say we need to adapt. It isn't always the case that we can actualize exactly how we feel, because sometimes doing so might cross up the rules that society has set up. But this triple vulnerability model of anxiety disorder sets up a biological predisposition for the handling of stressors, a psychological skill set that we develop during childhood based upon mirroring how others deal with stress while we are in our operational and pre-operational stages before adolescence, and then specific determination and skills that are unique to what we have developed ourselves. Skills can be developed, take longer, and take pause. You've heard people say count to 10. Take pause over reacting to our predisposed fixed mindsets. When we find that we cannot react in ways that are sociologically acceptable, we have a predisposition to generalized anxiety disorder.
Say you've got a huge presentation in front of all your colleagues. You're nervous. You've got quite a bit of stress leading up to the presentation. That stress is completely normal, and really probably useful in certain situations since it can make you more alert and careful. After the presentation's over, you feel the stress start to fade away, right? Well, for 3% of the population, the stress doesn't go away, and maybe that stress isn't even brought on by a specific event, and it's always just sort of there. Either way, at this point, it's considered to be anxiety. That anxiety might get worse over time and cause things like chest pains or nightmares. Sometimes the anxiety is so severe that it causes someone to be anxious about leaving the house or doing everyday things, like going to work or school. This anxiety might be a sign of generalized anxiety disorder, sometimes shortened to GAD. GAD is characterized by excessive, persistent, and unreasonable anxiety about everyday things like money, family, work, and relationships. Even sometimes the thought of getting through the day causes anxiety. If the anxiety is persistent, then it doesn't seem to go away. If it's excessive, it's usually more than someone else might feel, and if it's unreasonable, they probably shouldn't have a reason to feel anxious about it. People who have GAD might even understand that their anxieties are excessive and unreasonable, but they feel it's out of their control and don't quite know how to stop it. People with severe GAD might be completely debilitated and have trouble with the simplest daily activities, or they might be only mildly affected and might be able to function socially and hold down a job. Sometimes the feelings might worsen or improve over time. In addition to having feelings of worries and anxiety, other symptoms include edginess and restlessness, difficulty concentrating or feeling like the mind just goes blank, and also irritability. And these psychological symptoms can also lead to physical manifestations of symptoms, like digestive problems from eating more or eating less. They might also have muscle aches and soreness from carrying tension in their muscles. Finally, difficulty sleeping is a really common symptom that can have a serious impact on physical well-being, since the body's not resting. And this can lead to issues of chronic fatigue. Although the decision that someone's worry is excessive and unreasonable has a subjective quality, diagnosing GAD is aided by the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. This manual gives a list of criteria to meet in order to be diagnosed with GAD. First, the excessive worry and anxiety has to have been present for more days than not over the course of 6 months. In other words, a person should have the symptoms of excess or unreasonable worry on 90 or more days out of 180 days. Generally, people can't quantify or track their feelings in that way. So again, this is meant to offer a general guideline, right? Okay, second, the person finds it hard to control their anxiety, meaning that they have a hard time calming themselves or self-soothing to help themselves regain control over their feelings. Third, an adult must have 3 or more of the symptoms listed previously. In children, though, typically defined as school age, so between 6 and about 18 years old, only 1 symptom is needed for the diagnosis of GAD. Another criteria is that the anxiety causes impairment in important daily activities like school or work. For example, they might miss deadlines or find it difficult to even go to work because of their symptoms. Fifth, the symptoms are not attributable to the physiologic effects of drugs or medication, or due to a medical condition like hyperthyroidism, which creates an excess of thyroid hormone, which can sometimes cause symptoms of anxiety and worry. Finally, their anxiety isn't better explained by another mental disorder, like social phobia or panic disorder. Just like a lot of other mental disorders, it's unclear exactly why some individuals develop generalized anxiety disorder, but it's thought to be a combination of genetic and environmental factors, as it seems to run in families. It also has been shown to be twice as prevalent in females than in males. Treating GAD, like many mental disorders, may involve psychotherapy, medication, or a combination of the two. If it's psychotherapy, cognitive behavior therapy has been effective since it teaches the patient to think and behave in different ways, and react differently to situations that would usually cause anxiety and worry. Medications like benzodiazepines or antidepressants might be prescribed as well. Benzodiazepines are a type of psychoactive drug that have a relaxing and calming effect. Antidepressants might also be prescribed, like selective serotonin reuptake inhibitors or SSRIs, which regulate the serotonin levels in the brain and help elevate mood. Even though both medications and cognitive behavior therapy have similar effectiveness in the short term, cognitive behavior therapy has major advantages over medication in the long term, due to unwanted effects of the medication like tolerance, dependence, and withdrawal.
So what are our treatment protocols? Now, our treatment protocols are not largely different than treatment protocols for other areas of psychological opportunity. In the modern era, Freud's cognitive behavioral therapy, which he called psychoanalysis, is the predominant treatment modality in which a psychological therapist employs a variety of treatment skills that treater has learned in order to create a new outcome to exposure. Now, it is not the case that if a person gets high anxiety from fear of roller coasters, that automatically you should assume that that is an unrealistic fear, and then buying a season pass to Six Flags and going to Six Flags every other day will solve that problem. It could make it worse. It could create chronic anxiety by pushing a person past the point of distress. Exposure therapy must be in alignment with the Jungian personality traits in order to ensure that we're not challenging our distress mechanism, which is individual. The idea is to create new associations, and those new associations might have a different response mechanism. So rather than going to Six Flags, if that creates chronic distress, maybe hiking, camping, taking a scenic trip to a state park might have a response prevention approach rather than an exposure to chronic anxiety. Again, the value of cognitive behavioral therapy is sorting all these out in relation to the individual without judging the individual from an id perspective, who they are. The idea of the function is to increase experiences which allow for actualization, decreasing associative responses which increase stress. Again, increase experiences that actualize without increasing stress. we're going to conduct a Socratic seminar about propensity to be engaged in qualifying experiences. And so our seminar is going to revolve around these cognitive distortions and a description of how they affect our anxiety and our stress